I think, I think we had too many muffins and coffee this morning. People can't even sing. Where is your energy, guys? Where is your energy? For those who are not here, I'm going to be your programs director for the day. My name is Lindiwe Zulu from Partners in Sexual Health. My job here is very simple, guys. It's just to follow the program and make sure we stick to time and we stick to the COVID regulations. Please keep social distancing at all times. And please, when you leave the room, make sure that you do not disturb the proceedings inside. It is now the time that I introduce someone who's going to formally open and welcome us to this glorious event. But before I call upon Mr. Netsipale, let's quickly have a look at this video.
Why do men and boys abuse women and girls? Why do they hurt those they claim to love? Why do they even kill them? What is going on? As the world is facing a crippling coronavirus pandemic, women and girls are facing a different kind of pandemic, a disease outbreak that affects every third woman around the world, a health crisis that refuses to go away. Like all outbreaks, COVID-19 has deepened the existing gender inequalities and increased risks of gender-based violence. It has led to loss of employment, created financial insecurities, and left many wallowing in debts. As a result, it exposed women and girls to risks of intimate partner violence, survival sex, transactional sex, sexual exploitation, and sexual abuse. The socio-economic pressure caused tensions and conflicts in households, often leading to violence. COVID-19 has also put a strain on healthcare services. It reduced women and girls' access to gender-based violence services. It has affected access to life-saving care and support to GBV survivors, such as clinical management of rape, mental health, and psychosocial support services. Yet, sexual and reproductive health is a significant public health issue that requires attention. Abuse of alcohol and drugs and availability of weapons increase the risks of gender-based violence. Unfortunately, resources including law enforcement services are redirected and reduced to respond to overall health crisis. The Department of Social Development has introduced gender-based violence risk mitigation interventions. It made available social relief of distress packages including social grants, grants for the unemployed, increased old age, and children's social grants and food parcels. The Social Development Department has established a Gender-Based Violence Command Center, GBVCC, in response to violence directed against women. Survivors of GBV are urged to call the GBVCC for various services, including psychosocial support services. Men who are perpetrators of GBV are also encouraged to seek counseling and professional help from the GBVCC. Please call 0800 428 428 or send an SMS to *120 *7867#. Those with disabilities are urged to send SMS help to 31531. Violence against women is violation of human rights. Stop gender-based violence, because we can.
Hola, bacha, hola. Hola, bacha, hola. I'm looking with bacha here. Are you youth? Hola, bacha, hola. I wanted to say long live to sexual and reproductive health. Long live. Long live to sexual and reproductive health. Long live. Honorable Minister of Social Development, Lindiwe Zulu, Beatrice Mutali, the Country Director for UNFPA, Ms. Pansy Diloro, from the Partner for Social Health. I think you must finalize something there. Dr. Isaacs from HSRC, Dr. Willem du Toit, our colleagues from the Department of Social Development here and nationally. Hola, bacha, hola. I think as we start this program today, it's important to note and to realize that the topic that has been chosen as the theme for this year, the World Population Day, which was supposed to be held in July, is one of the important topic. And I think the focus from UNFPA and Partners for Sexual Health is one of the things that in our traditions, when we grow up, it becomes like a taboo, what to say, what not to say, when to say, how to say. But what is it that we need to deal with? I know I'm here to welcome you, but I think contextually, WHO says, what is health? What is a complete state of physical, psychological, and mental well-being? What is sexual and reproductive health? Emulate exactly that. That is a complete state of physical, mental, and social well-being, especially sexual health, which everyone tries to shun away. And I'm so glad that all of us are leading this. This implies that as human beings, especially youth, need to have more information, need to be able to be satisfied with their sexual life, starting from being youth, so that they can grow up being capable, reproductive beings that produces and that ensures that there's health within the reproductive health. We are saying to our youth, let's have accurate information, say it as it is. I think the minister was trying to say something, she will say something. Say it by the word. I am a nurse by profession. We say it exactly. If you come and say, no, it's like I've got pain. Wait, tell me where. Exactly. Because you must tell me exactly and I will do exactly that. If I've got a headache, I give you Panado. After 10 minutes, is it going? Yeah, it's gone. Done. Youth, we gathered here today for one of the things that we should have done in July. But due to COVID, we could not have a World Population Day. And like many commemorations, we had a theme. We have got a theme that together with UNPA have identified. This year is dedicated to raise awareness about sexual and reproductive health rights that each and every human being has, including women and young women, especially women and girls. So, as we will be dealing with this, I hope that this is Jacques. As we start here, we will establish a movement of ensuring that our reproductive health is looked after. Our reproductive health, sex and reproductive health rights are enshrined, are practiced. I'm not saying you must go and practice something. We are practice the information and the awareness is there. We teach you, you teach others. And one of the things that you need to know about reproductive health, sex and reproductive health, is to love ourselves, to admire ourselves, and also to know our rights. So ladies and gentlemen, I am here to just open and welcome everyone, speakers that are here. And I hope that we are going to be working together and ensuring that sexual and reproductive health rights are enshrined in our documents, within our community, with our youth, and with everyone that we have. And that a movement will be established. I'm happy that Zizile is here. They said we must incorporate it into the youth camps next year so that is done, and working with the non-profit organizations that are here. Minister, we will be able to deal with this and make sure that next year we measure what we have done this year. With that, few words, ladies and gentlemen, let me say this short session is open, and you are all welcome. Feel free to show us how we are going to teach other people. Thank you very much.
Thank you, Deputy Director. I just want to clarify something, that the first two speakers and myself, it's just a coincidence that we come from a home of champions. So it is not nepotism, it's just we are champions. And we are in a room full of champions. So welcome. It is my honor now to ask the Acting Director General of DSD, Mr. Lindiwe Zulu, to give us the purpose. Please give him a round of applause.
There's something on social media that's going around some time ago. It was saying wishy, 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 wishy. Do you remember that? Do you remember that? You don't? Okay. You haven't seen it? We'll share it with you. Good morning. How are you doing this morning? Aye. Sanmonani. Ninjani. Dumelang. Legai. In Venda we say, ahe. Nda. Peter will kill me if I mess up his home language. Are you well this morning? I don't think you are. Are you well this morning? Yes. Are you sure? Yes. Okay, great. What I like about this audience, Minister, is that there are more females than there are males. That's a good thing. Hello. And there are more young people than there are older people. I'm still in the bracket of young people, Minister. I must indicate that. I'm still in the bracket of, a few years ago I used to say I'm still on the calendar. I haven't stepped out the calendar yet. Thank you very much, Honorable Minister, panelists this morning, young people, ladies and gentlemen. Thank you for this opportunity. Mine is very simple. It's really to give you the purpose of the event and tell you what we expect from this engagement this morning. Now, my name is Lindiwe Zulu, and I'm from the Department of Social Development. Every year on the 11th of July, we commemorate World Population Day, and it's a day that is on the calendar of the United Nations. And all member states commemorate this day, highlighting the work that they've done in terms of population development, which includes issues around the demographic dividend. Does anybody know what's the demographic dividend? Anybody? I'll give you 100 rand if you can tell me what's the demographic dividend. Nobody. Yo, Minister. Nobody. So nobody wants 100 rand. It's free money. They want to see it. You don't believe me? Okay. I think they're waiting for me to up it to 200 rand. I'll give you 200 rand if you can tell us what's the demographic dividend. 200 rand. Okay, I'll give you 300 rand if you can tell me what's the demographic. No. I think we need to go back to school. There's a challenge here. No, it's too late. The offer's gone. I would have given it to you when you... It's too late. She Googled very quickly. Oh, she was waiting for a higher amount, you see. You see, young people are very smart. They know how to manipulate you and to get what they want. But anyway, the demographic refers to, in the main, or it speaks to a country that has many young people and a country that deliberately invests in them, whether through healthcare, through education, through training, through skills development, and provides economic opportunities for them, which in turn will create an active workforce that contributes to the development and growth of a country. Now, if we don't do this as a country, we'll have a country of young people, or we'll have a country that is not creative, that is not innovative, that is unskilled, that is not aware about the critical matters pertaining to their very own development, that have no clue about the development or developing issues in the country. At that point, does anybody know what's the economic recovery plan? Does anybody know about the economic recovery plan? No, Minister. 100 rands. Can anybody explain what is the economic recovery plan? Gone. Now this is a concern, and let me tell you why it's a concern. Because as young people, if you don't understand what's the development objectives of the country, you're not going to be able to tap into the opportunities that are enshrined within those various development trajectories. I'm shocked that you don't know what's the economic recovery plan. The president announced it just a few days ago. And it's important that you understand the direction that the country wants to take. Hey! By the way, Minister, on Gomorrah, there's a picture of you. I don't know if you've seen it. I shouldn't have said that. They will make it an excuse that, no, they're learning through Gomorrah. Anyway, it is a concern that you don't understand, or you may not know, or maybe you're shy to speak about it, maybe you do know, about the important development objectives of this country. And it's important that you tap into that, because you need to locate yourself as an individual in those development plans. And we'll have people who are not able to solve problems. What does that spell? What will that result in? A country that is not innovative, a country that has no skills development, young people have no skills development, not creative, have no clue about the development trajectory of the country. What country will that be? That will be a country that is in disaster. So it's important that we invest in this kind of work. By the way, the demographics aspect speaks to the opportunity. And let me tell you something about opportunity. There's a man by the name of Leonard Ravenhill, and he makes a statement. He says, opportunities of a lifetime must be seized in the lifetime of the opportunity. And if you don't take hold of the opportunity whilst you have the opportunity, I tell you, you'll wake up tomorrow and you are 36 years old. And you are 37 years old, and you are 30, and you're 40 years old, and you've achieved nothing, and you've done nothing with your life. So you've got to grab hold of the opportunities that are available. Government makes so much opportunities available for young people. And if you don't tap into that, you're going to find yourself growing old without these skills, without being innovative, without being creative, and that's a challenge. We'll have a country that is problematic. So I want to encourage you, young people, please make time to understand what opportunities there are available for you in the country, not just from government, but from other partners and members of civil society, etc. Let me go into this quickly. Now, of course, COVID-19 made it difficult to arrange an event in South Africa on the designated day. We were in the heart of the lockdown, as you would recall. And the Department of Social Development, working together with UNFPA, initiated a social media campaign in partnership with Partners in Sexual Health, which is PHS, right at the start of the lockdown, to advocate to young people to continue looking after their sexual and reproductive health and to remain active against gender-based violence. You know that as a fact that the president has announced that gender-based violence is the second pandemic. It's a problem in this country. And we need to address it. We need to be frank about it, and we need to address it. It's a problem. Our young men, our young boys need to understand the value of women and girls. And they need to understand the values, but also we need to respect young girls and women. Otherwise, we're going to have a challenge, ladies and gentlemen. So in 2020, to commemorate World Population Day, governments in collaboration with the UNFPA were encouraged to raise awareness about sexual and reproductive health needs and vulnerability of women and girls during the pandemic, to highlight how we can safeguard the hard-fought gains and ensure that SRHR, which is sexual rights and reproductive, sexual rights, sexual, SR, sexual, SH, so we're in school here, right? Right? SHSR, let's keep it there. Right. So how SHSR, how we keep that on the local agenda, and to explore how we maintain the momentum towards achieving the Sustainable Development Goals. Anybody can tell me what are the Sustainable Development Goals? 100 Rand going once, twice, thrice. Let's leave it at that. And to rally around the decisions that we took in Nairobi last year during the Nairobi Summit. So building on these, the purpose of today's event is really to raise awareness, but equally importantly, to receive feedback from PSH and young people on the social media campaign that was held some time ago, to announce research that HSRC, see all these acronyms, will conduct for the Department of Social Development on young people's experience of the pandemic, of the impact of the pandemic, including their sexual rights and reproductive health. But also to hear from young people themselves about their experiences during COVID-19. Now, we want to understand and we want to know your experience during COVID-19. Was it difficult for you to go to clinics and get your medication? Was it difficult for you to get the kind of support that you ordinarily would get? And we do this because it's important. We need to understand as a government, working with our partners, what we need to do better and how we need to support you better. What we need to do and what will the impact of the second wave, which by the way is upon us, so that we learn lessons from the first wave that we had in terms of COVID-19 and we make it easier for you. You see, in that way, we hear it from you, from the horse's mouth. We're also able to put together evidence-based research on the challenges that you have had during COVID-19 so that we improve the manner in which we provide our services to you. So today, we really hope that you would be honest, that you would be frank, and that you would have robust discussions. And we really look forward to taking these discussions forward, that it's not only today, but even as days go by, we will continue having these conversations. And maybe when we come back, we will up the fee and we'll say 1,000 Rand for anybody who can tell us about the economic recovery plan. Thank you very much.
Can we talk outside about the money? I was still sleeping, so I wanted to recover from that. Okay, let's just have a quick look at the video, then I'll introduce our third speaker.
Sexually active girls between the ages of 10 and 19 years can fall pregnant. Sex without using any form of contraception can lead to unwanted and unintended pregnancy. There are many reasons why adolescent girls fall pregnant. Majority of them fall pregnant because they do not understand the risks involved in sexual intercourse. Other girls become pregnant because they do not know how pregnancy happens. Yet, others want to prove that they are mature and that they are grown women. Other causes of teenage pregnancy include difficulty to obtain or lack of access to contraceptives, absence of reproductive communication with parents, negative peer pressure, and use of alcohol. Sometimes young girls have low self-esteem and therefore are unable to say no to sex. on low birth rate of the child or the child is born prematurely. The teenage parent can also suffer from depression after the birth of the child. This is known as postnatal depression. Furthermore, adolescent pregnancies interfere with young girls' education. This results in fewer job opportunities for the adolescent parent. Another challenge is that teenage mothers report more significant hardship than adolescent fathers. To prevent unwanted and unintentional pregnancies, young people must ask for sexual and reproductive health advice from teachers or an adult that they trust. You must use safe and reliable contraceptives every time you decide to have sex. Also use reliable condoms regularly during sex to prevent HIV infections and unplanned pregnancies. Above all, resist the peer pressure to become sexually active when you are not ready to do so.
Siakwazi is really teaching us today, yeah? We are really, guys, stop using condoms in your knees and saying that's correct condom usage, yeah? Your knees and your elbows, and use that sponge for makeup, and that's not correct, consistent condom usage. Yeah, that's another usage. Let me introduce my next speaker. I wanted to say to you, Mr. Mkud, please learn this word. Because when I started with SRHR, I keep on struggling. Yeah, it's partners in sexual health. It doesn't stop there by sex, because they always say we are partners in sex. Or they call us and they're asking what type of sex are we selling. That's not the organization. We're in advocacy. Our next speaker, I've got a chance to meet her in 2009. Her passion at heart was really about young people. Young people at heart, even when she was still working for Global Fund in the department, her mission was all about young people, empowering young people, empowering young girls to take initiatives. And when she served in structures like SANEX and BRICS, but she still had the passion to be with young people. That's why young people, even today, still call her Mama Youth. She is the founder of Partners in Sexual Health, Siakwazi Youth Network, and the Because We Can, which runs regionally in the African continent. Ladies and gentlemen, allow me to welcome the CEO and founder of Partners in Sexual Health, Ms. Patsy Dilora.
Yes. Good morning, everybody. As Jabu introduced myself, my name is Patsy Delora, Partners in Sexual Health, Mama's Youth. Correctly, so thank you, Jabu, indeed. Good morning, Minister. Good morning, all partners. Good morning, everybody. Good morning, Siakwazi Youth Network. Good morning, young people. It's my privilege to explain to you what we've been currently doing under the COVID in terms of SRHR. COVID actually made us realize to think out of the box, I have to admit. We started engaging and coming up with new innovation to the highest order. And then we actually realized in a sense that maybe it's a good thing. Yes, we understand COVID is detrimental to some, but I think for an organization like us that deals with young people across South Africa and even in the SADC region, it's sometimes a lot of money that we have to spend to reach these young people. So because of the new media approaches, we realize this is maybe the way to go for us as an organization. Not just to save money, but to reach 10 times more thousands of young people across the SADC region, and also inform them. So it's my privilege just to give you a little bit of background of what we've been doing all this time, what we've been doing with our advocacy and social media platform with Department of Social Development and UNFPA, and then also what we're planning to do for the future in terms of innovation. So yeah, without further ado. So this is who we are. We are a national organization. We're in fact moving now within the next year to the SADC region. We have offices across South Africa, and where we do not have offices, we actually utilize our Siakwazi youth members to provide the services and train them well to provide the service to the young people on the ground. This is what we do. We have a variety of different projects that we implement across South Africa, as I say. The reason why we did it, we started with one project in 2009. That was CSE in school. That was my main focus when I used to work for Global Fund. And after a while, when we started the organization, I realized that there is such a huge of need in terms of SRHR amongst these young people that we cannot just look at the in-school, but we had to actually look at the young people, the other schools. So we started with the out-of-school youth project. And as time went on and the organizations built and get bigger, we added more projects as we go along. But I have to mention that all these projects didn't come out of the sky. These projects came from our research that we've been doing across South Africa. Our projects came from the information we received from the young people on the ground. What we try to do within the organization is not to come just because where the money flows, you go. We've been an SRHR organization since day one. Our focus is not HIV. Our focus is sexual reproductive health and rights. HIV is just a component of the bigger picture of SRHR. So as you can see, all our different projects have a specific target audience and specific issues. So we deal with advocacy, we deal with prevention, we deal with research, we deal with support, we deal with services. We actually provide our young people a package of comprehensive and integrated type of services when it comes to SRHR across South Africa. The other thing what we now embarked on, and which is new on the line, as I said, in terms of COVID, we are launching, hopefully, with COVID, we have problems with Telkom. Otherwise, we would have been by now launching our SRHR hotline. This hotline will be available across South Africa for young people. We are planning, in fact, we've signed already MOUs with Lifeline, and we're looking for relevant other partners that have hotlines. We don't want to reinvent the wheel. We're also engaging with the Department of Social Development in terms of their hotline. So the service that we will focus will not duplicate services, but rather complement services. And because our Siakwazi Youth Network have a membership of about 8,000 young people across South Africa, I think that it's a matter of one another providing and taking in hand, and you provide the service and PSH provide the type of services, and the ultimate issue is for the young people to actually get as much information and services as possible. The other one exciting thing that we are busy now in our office to set up, we were privileged to get funding from the Amplify Change. This money was supposed to do for projects that we engage with young people directly. We've changed it now, we're moving on to a radio station. This actually came from the young people. They believe that we rather go for the radio station. It will be an SRHR radio station. It will be manned by young people. We've got people that's going to train our young people on how to man a radio station. We foresee that we will engage and invite the relevant stakeholders and partners on our radio station, engage with people, and spread the word at a 10 times much higher rate than, as I said, just having one-on-ones or specific trainings with these young people. The other initiative that we've also done in terms of innovation, we're going online. So we are currently busy with online trainings. One of it is for government officials in terms of SRHR and policies. We do realize sometimes, with all due respect, Minister, that our government officials sometimes are not everybody clued up in terms of SRHR. So we're developing an SRHR directed policy type of training for government employees on online training. We also, which is interesting enough, the previous speaker was saying, and we asked to the young people about the demographic dividend and what the SDG stands for. It's quite difficult, I have to say, to teach and train each and every young person about these issues that actually affects them. And because Siakwazi Youth Network is a network that look at advocacy, we've realized, and this I've been picking up for quite some time ago, is that our young people are not properly trained on policies. So what we're embarking on now is to develop an online training on all SRHR civic education policies For young people to really understand that where it comes from. It comes from the UN level to the AU level to your national level, and how it integrates and what impact these policies, treaties, and regulations have on these young people. So if we want to truly, for our young people to become advocates in SRHR, they need to understand the policies and the regulations and treaties. And therefore, we're moving to an online platform where our young people will be trained now very nicely in their own space and get trained on these type of things. So yeah, as you can see, the members out here, Siakwazi Youth Network. Our youth network is a combination of a lot of diverse young people. We have members that is disabled. We have LGBTQ+I members within our network. In fact, we have them all. It's a diverse group. We're not looking at who and what you are. If you're in the age group of our Siakwazi Youth Network membership line, young people across South Africa are more than welcome to join our youth network. We also, one of the key things that Siakwazi Youth Network provides and support is looking at internship bursaries for our young people. So we created a space where our Siakwazi members can click a button, and if there's opportunities that we arise or we see, they can have access to these things across South Africa. But sometimes our young people will sit in some rural area in Limpopo and never know, and the opportunities will pass them by. So that's one of the key things that Siakwazi Youth Network is also bringing to the table. This is the social media. I have to admit, looking at all our different platforms that we're utilizing after the COVID-19, as you can see, we've almost reached 900,000 young people across South Africa within a space of almost just, how many months is that now? Since April, May, June, July, August. Okay, 6 months. So basically, so we can just see the power of utilizing social media when it comes to young people. We've been providing the videos that we are showcasing today. That's one of the key things that we're actually developing for the young people. We shared with our members, with our stakeholders. We're also looking at innovative ways how to engage these young people on our Facebook. We're having discussions with these young people. Luckily, we are privileged to have young people as staff members, so they're taking the drive in terms of this processes, engaging these young people on the issues of SRHR, and that is currently what we've been reaching. So we're utilizing all the channels. Partners in Sexual Health is about partnerships. So we partner with whoever we can that can contribute to the benefit of our young people in South Africa. Last but not least, we've just approved that we will now embarking on almost becoming a mother body for youth-led organizations in SADC. We are privileged that we can actually support youth-led organizations where there is a huge need. There's a lot of young people, I think everybody knows, that have organizations, CBOs, NGOs, but nobody provides these young people with support and capacity. So PSH is embarking within the next week. In fact, our advert is going out for youth-led organizations that will qualify. We will take them up as our babies. We will support them, give them the relevant support, technical support most probably with funding as well, give them guidance, and so that we can actually have a group of young people, youth-led organizations within the next 10 years, that these young organizations will actually stand proud and be the leaders when it comes to sexual and reproductive health and rights in SADC. On that note, I thank you.
Thank you, Ms. Dilora. I must say, when we are talking about going online, I was like, am I losing my job now? Am I going to stand in front of cameras? What is online going on? And then I started seeing animations. I said, oh, no, my job is gone. No more facilitation. But now I understand. I can still give input here and there. I can still stand in a space where there's less people. But thank you, Mr. Love, for that input. Please, let's give a round of applause to our next speaker who's going to give us the theme of our World Population 2020. Let's welcome Ms. Beatrice Mutali from UNFPA.
Thank you very much, Program Director. It is, I must say, quite a challenge when you have to follow three very vibrant, enthusiastic, and motivating speakers, but I shall do my best. I want to first start by really appreciating the presence of the Honorable Minister, Honorable Lindiwe Zulu, and also the officials from government, civil society, our distinguished colleagues from PSH and HRSP, members of the media, and very importantly, of course, our illustrious panel of youth champions who continue to live the ideals on population and development, and also on universal access to sexual and reproductive health. A very good morning to all those participating, and including those who are watching through live streaming this dialogue that is happening today. In particular, I also want to acknowledge all those young people who are in the middle of their year-end exams and who have taken the time to engage on these critical issues. As said by speakers before me, we are here to commemorate the World Population Day, a day, again, that has been said is usually commemorated or celebrated on the 11th of July every year, with the purpose of focusing our attention on the urgency and importance of population issues, particularly noting the implications on our overall development. I think this is very significant, particularly for South Africa, noting that when we look at our population in the country, and we note that the significant part of the population is really comprised of young people. Young people 35 years age and below comprise 66% of the population. Hence why it's so pleasing to see today that a significant part of this event is going to be focused on us listening to young people. Because young people, for us, they hold that opportunity for the country. They hold the opportunity if we invest, if we continue advocating for the investment in young people. I think the acting DG really articulated it very well. And I'm assuming that many of you probably did not just want to speak up, because it's very important as young people that we continue to advocate for that investment, because it will determine your future. Investments in your health, your education, your employment, and your empowerment, because it is that will reap the demographic dividend for the country. Moving back to the forward to the theme of today, putting the brakes on COVID-19, how to safeguard the health and rights of women and girls. This theme, although it was a theme that was developed for July, it still remains very relevant to us today, because COVID-19 crisis continues to take a staggering toll on people, on communities, on the economy in South Africa, across Africa, and globally. But we also recognize that not everybody is affected equally. Women and young people continue to be disproportionately affected. Women account for the largest share of frontline health workers, like we all know, and because of that, they are disproportionately affected. Many women, again, as we recall, were trapped, and some continue to be trapped by their abusers at the time of the heightened household tensions and resulting reduced prevention and protection efforts also resulting in reduced access to social services and care. In South Africa, we saw reports of heightened gender-based violence that surged since the breakout of the pandemic, and particularly during the phase that we were going through the lockdown. The COVID-19 pandemic has also had a devastating impact on the delivery of sexual and reproductive health services around the world for young people. And this has been affected in different ways. We have seen the closure of social spaces, including schools, community centers, health clinics, where young people would ordinarily receive their comprehensive sexuality education and also other information and services on sexual and reproductive health. This resulted, of course, in many of them not having access to the essential services that were needed. And UNFPA, having tracked the progress, projects that COVID-19 will slash by at least 1/3 global efforts of achieving key targets set for 2030. These are targets towards ending to ending various challenges related to sexual and reproductive health, ending preventable maternal deaths, ending unmet need for family planning, and ending gender-based violence during this decade. So that just means that we really need to fast track or really place a lot of emphasis if we are to catch up and make up for the lost impact. But what have we been doing as UNFPA alongside other UN agencies? Since the COVID-19 pandemic broke out, we've partnered with government and civil society organizations to support continuity of reproductive health services, including maternal health services, to maintain uninterrupted supply of contraceptives, but also essential life-saving commodities that are needed when to save the lives of women at the time of giving birth. We've also partnered, as you've heard, with we've also partnered with civil society organizations in working on social and behavior change communication with a focus on COVID-19 and the need to respond to the needs of adolescents and young people. The disruption of schools and routine health services during the lockdown necessitated UNFPA to adapt creative and flexible outreach strategies to reach young people, particularly through digital platforms to promote comprehensive sexuality education and social and behavior change communication. One such effective partnership, one of our key partnerships in particular, has been the partnership with the Siakwazi Youth Network. At the onset of coronavirus, through Partners for Sexual Health, UNFPA partnered with the Siakwazi Youth Network to amplify SRHR messaging and create awareness on SRHR topics and prevailing issues in the context of COVID-19. It is often said that young people play a significant role in contributing to the dissemination and sharing of key messages, and as such, one of the approaches to addressing the spread of the virus was to engage young people on social media platforms through the provision of factual, age-appropriate information about SRHR in the era of COVID-19 pandemic. Essentially, as we grapple with the pandemic, what we have come to understand is that COVID-19 is affecting everything we do, including our efforts to promote SRHR and ensure young people's ability to obtain the use of contraceptive methods of their choice, but also to prevent themselves from other sexual and reproductive health challenges and infections. Effective partnerships and coordination is key to our ability to respond to and cope with the pandemic, and to empower young people to safeguard their health and well-being. COVID-19 is a stark reminder of the need to reaffirm our collective commitment to working together. I'm therefore very encouraged and heartened by the commitment of young people. They must be at the heart of our development efforts. So really, again, just reiterating how pleasing it is to see the participation of young people at today's event. Before I end, I really just want to congratulate the Honorable Minister again on her appointment as Chair for Partners in Population and Development, and her leadership role as being part of the global oversight role on population and development over the next few years. Population, as we all know, affects every aspect of our development. So by having our minister from South Africa be part of the lead, I think provides a great opportunity for the country, and we really are proud of that. So I'd like to end there and thank you, and look forward to really listening to a very vibrant conversation. Thank you.
Thank you very much, Ms. Mitali. I would like to say the power of these videos spreads very viral. If you remember when people saw it went viral. Let's make SRHR videos also viral like that. Please, let's enjoy our videos and then introduce our speaker.
Coronavirus travels from one person to another. The coronavirus attacks mostly people whose immune systems are weak. However, experts say people living with HIV and who are on effective antiretroviral treatment are not currently at an increased risk of getting coronavirus or developing serious symptoms. People living with HIV not on treatment or virally suppressed medication may be at a greater risk. Kindly speak to a healthcare professional for more information on how to stay healthy. Thus, coronavirus is not a death sentence. Just because you're living with HIV, you simply need to take care of yourself. If you're living with HIV and have a low CD4 count, a high viral load, and had a recent opportunistic infection but you're not on treatment, you are at greater risk of infection. Take care of yourself. If you are living with HIV and have other underlying health conditions, take care of yourself. If you are living with HIV and have a respiratory infection but not managing your health well, take care of yourself. Your health matters. You matter because you can. The advice for people living with HIV is mostly the same as everyone else. Wash your hands frequently with soap and water. Use an alcohol-based hand sanitizer for situations when you do not have access to soap or water. Avoid touching your face, as this is one of the ways the virus enters your body. Avoid people who are feeling unwell or sick. Cover your nose and mouth with a clean tissue when you sneeze or cough. Throw it away and wash your hands. If you don't have access to a tissue, use the inside of your elbow to cover your mouth and nose. Remember, you are not alone. You will never be left behind. Together, we shall win because we can.
Just to clarify something from the video, it says use alcohol-based sanitizer. It didn't say use alcohol to sanitize. It didn't say sanitize inside out, no. Okay, let me introduce my next speaker, who's gonna give us studies done on young people from the Human Science Research Council. Please welcome Dr. Isaac from the Human Science Research Council. Please give her a round of applause.
Gotta adjust this for short people. Good morning, everyone. Good morning, Honorable Minister. It's great to be in your presence. To colleagues and officials from the departments and advocates, it is really hard to go after you with all that energy that you have. And most importantly, good morning to the youth. Today, I want to talk about a study that we are going to undertake on behalf of DSD as the HSRC. So we haven't done it yet. We are going to embark on it soon, and we'd love to hear your thoughts and inputs and get you excited about the study, because we cannot do research without you. So my name is Zainab Isak. I work at the Human Sciences Research Council, or HSRC, out in Sweetwater. It's a little community outside Pietermaritzburg. And this particular study I'll be conducting with colleagues from the HSRC in the Human and Social Capabilities Division. 2020 has been one for the books. So, yeah. To get it in the books, we need to understand what about 2020 impacted youth, how it impacted youth, and how we take this forward. And in order to write about it, we gotta do some research. So today I'm just gonna cover quickly what the research the HSRC will be about. This is a story we're all familiar with now. That virus was on TV for such a long time, and we saw it. Made some of us very nervous, some of us scared, some of us panic, and now some of us getting complacent. So we want to understand for you as youth how this virus has impacted you. Our first reported case was on the 5th of March in this year, and it was out in Hilton, and that's like about 5 kilometers from our office. So you can understand we were all nervous and then wanting to work from home. I've been working from home since March. It's my first plane trip to Cape Town was for this. First trip outside for work, for anything, seeing people, which is really nice, actually. So we thought immediately that it was for people who were traveling, right? So COVID was something a little bit foreign. And then it came to us, it came to communities, it came to youth, it came to children, not really, but at schools, and adults and our grandparents, and we were all worried, even if we are exposed, how does it impact on our adults in our homes? And it was burdensome. I checked Facebook, I checked News 24, I checked the NICD website, I checked government reports almost every hour, every 5 minutes, to a place where it felt overwhelming. And I'm sure many of you did the same thing too. So we know that COVID made an impact when it came on. And when our president told us to social distance or physical distance, to wash our hands, to sanitize, and to wear masks, we did that to flatten the curve, and we still need to continue doing that. But also what happened was we were used to this face-to-face interaction, so we went to online interaction. Some of us were afraid of losing our jobs because things are digitized now. Alcohol and cigarette sales were restricted. Schools closed down. Our healthcare facilities focused on COVID, and so many of us were worried about going to get a contraceptive, a flu injection, condoms, other services that we needed because we worried about what happens when we go to the clinic. So COVID impacted us directly and indirectly in very nuanced and multiple ways. But we managed it, and we are managing it. But next slide, please. But we don't really have a grasp on the depths to which it impacted on you and other children and other adults and other youth in communities, in schools, in tertiary education systems. On the car ride here this morning on the news, SAFM, they spoke about a young man in Siberia whose varsity had shut down, like many of your tertiary institutions and schools. But for this young man, he didn't have internet at home. How many people do you know, or raise your hand if you know someone who doesn't have internet at home? Okay, that is a struggle we face every single day. So e-learning is fantastic and important, but we mustn't forget about the people who don't have access to e-learning. So this young man walked kilometers and kilometers, and I don't know how many of you know about Siberia, it's really cold. And he had to climb a tree in order to get reception to study. And I mean, I lived in a community when I was young where children crossed rivers to access an education. They put their uniforms in buckets and they crossed the river because education is valuable and it's important. And we heard earlier, it gets us places, right? So we needed that education. And government has figured out multiple ways now in which we can access education as youth in different ways, e-learning, workshops, worksheets delivered, parents picking up things at school. But what does that mean for someone sitting at home without the internet or in a crowded house where they can't focus? That's what our study wants to find out. And the only way we can do that is by talking to youth themselves. So I've spoken a little bit about the study goals, and I'm going to speed through these quickly. And I think they resonate a lot with what people have spoken about already. So we want to talk to youth so we understand your level of awareness. And I hope it's better than the level of awareness you've had about the economic recovery policy and DD, right? I know it is. I see you with your masks. We want to unpack your perceptions and your personal experiences of COVID, which may be different from the Honorable Ministers and different from yours and mine. So every opinion matters to us. We want to investigate how COVID has impacted you as individuals and in your households, the people around you, the people who matter to you, from a health, psychosocial, economic and gender perspective. And in South Africa, we don't get away from the issue of gender and gender-based violence. I think throughout the lockdown, that's one thing that has echoed true is women and young girls face disproportionate health, economic, social barriers. And so that's always going to be at the back of our minds. In a study we just did at HSRC with our internal staff about working from home, women expressed a lot of challenges for themselves about having to juggle childcare, working, cooking, cleaning, schooling their children. And the men at work, some of them did share their responsibility, but overwhelmingly it was a burden that was placed on women. So our lives changed, and we want to understand how that happened. And then I think importantly, and I think you all need to understand this, you being in this room is not it's purposeful, it's thoughtful. Everyone wants you to own your issues. So you have a voice and you make decisions in things that affect your lives as youth, right? So ultimately, data that we get from research helps to inform policy, DSD's policy, government's policy, interventions that we develop as the HSRC. And we can't just go and sit in a corner and brainstorm something that is going to work for you. We need you to tell us what you need. What are your problems? What's the situation like, so that DSD can come up with interventions that are working, interventions that need improvement, and we understand what that is like for you. Next slide, please. So who can participate? I love South Africa because we have such a generous bracket for youth, you know, and so some of us can still say we are not off the calendar yet, so we are youth. So we are looking at people who are 14 to 35 years old, who are South African, and who have been a recipient of DSD workshops, and it's very broad. So if you attended a training workshop, you receive DSD interventions or programs, and they have you on their list, then we will consider you, because the way we will sample is that we get the list from DSD, and then we'll do something called a stratified random sampling, and that just means we want to choose deliberately but also by chance. And what is it like? Yes, we are moving online again, so even for us, it's not people going face to face. We are aware of COVID, and we don't want to put people at risk. So we'll do 3 online surveys or digital surveys, and the way that works is that we send you a link, we ask you to consent and volunteer, so nobody's forced to participate, and then you complete these 3 surveys at different time points in the study. And the first time point, which we hope will be January 2021, we still need to get ethics consent, which we've applied for already. We'll ask questions about your demographics and your background, what access to social grants you've had, and what DSD interventions you've experienced over the past couple months in particular, your access to sexual and reproductive health, your access to healthcare services, and your experiences of GBV. And this might not be yourself, it might be something that happened in your family, or perpetration of GBV as well. And then at the second time point, we'll ask you about COVID knowledge, so please brush up on that. We'll ask about your mental and physical health, where you get information from. Who gets information about COVID from Facebook? No one. You're lying. Okay, so some of us will get it from social media, from the media. Some of us wait for the president, right? Some of us get it from dubious places like our neighbors tell us, and those WhatsApp stories that people share and share. So we want to understand where you get your information from. And then we want to know your social behaviors. So are you wearing a mask? Why not? When do you do? Are you seeing your friends, and that kind of thing. And then at the last time point, we want to see if over the period of these different risk levels, your behavior changes. So we'll repeat some questions over time. I think I just spoke to this about the online nature of it. You'll get sent a link, you click on the link, fill out the survey. But we also are aware many people in South Africa don't have smartphones, right? So as another option, we'll ask you, once you become aware of the study, to send us a please call me, and one of our researchers will call people who don't have access to a smartphone and do the survey with them over the telephone. And our surveys last between about 30 to 45 minutes, so they are very detailed, but they are interesting. I'm sure you'll enjoy completing them. And then what will we do with this information? So we're asking a lot of you. We're asking you to complete all these questions. Thank you. I will be less than 2 minutes, I hope. And what we'll do with this information is develop reports for DSD. And what they will do is with this information is think through, as was said earlier, are the interventions that are there at present working? Where are the gaps, and how to plug those gaps? And this is why your voice is so critical. Next slide, please. So why do you need to participate? Anyone? I just said it. Your voice is so critical. You matter. The video said earlier, you matter. Take care of yourself. And the way you take care of yourself is by speaking and having a voice in things that affect your lives. So when you get that link, please consider participating. If you see it on the DSD website or on the partner's website, please share it with your other youth friends that may be eligible to participate. We would value just hearing from you about how COVID has impacted your access to healthcare, your experiences of the world and the way it's changed, so that DSD can make interventions for you and programs that are tailored to your needs. Last slide. Just to thank colleagues at DSD who've been really great helping us tailor and think through our questionnaires and our surveys, and to all of you for being here, being present. Thank you so much. Thank you for your time and attention, and please stay safe.
Thank you, Doctor. I hope most of us will be part of that study. If not, call me. I'm going to enroll them. I've got the database. Now it's the opportunity for me to talk. I've been introducing people and I haven't talked for a long time. So now we're going to have a panel discussion with young people. I think this is why we are here. So young people talking about their experience during COVID-19. So let's welcome my panels, please. Just bring your chairs and keep social distancing. Talking about access to SRHR services, it's Nolu Tomenta, all the way from Eastern Cape, Utenig. Please give her a round of applause. Access to information on SRHR, we have Tsolo Fellow, all the way. Tsolo, you live in different provinces. Today are you representing Northwest or? Northwest, give a round of applause for Tsolo Fellow. Last time I saw you in Limpopo, so I was confused. Also, she's born in Limpopo, lives in Mpumalanga, radio presenter. She's going to talk about mental health care. So let's welcome our Siakwazi spokesperson, Tabeleng Mukhashu. Social distance, keep social distance. Our young person in the SADC youth sector from the Western Cape province, let's welcome Tracy Lee Fredericks. Hey, kwenzekalani manje? Representing our young people living with disabilities, a champion surfer, national champion surfer. Let's welcome Nolutando Makalima. Don't worry, I can't surf. Guys, I wish you can teach me that. Last but not least, of our panelists representing a very key community in South Africa, a community that has been struggling and fighting throughout the 10 years and almost 20 years of our democracy. Let's welcome Nadia, representing the LGBTIQA+ community. Please give her a round of applause. It seems like I'm missing microphones, so I don't want you guys to come stand here and we sanitize every time we talk. Let me just skip to my mic. I own it for now. COVID-19 has impacted young people in many ways. Some economically, some with their education. But looking at South Africa as a whole, when we talk to young people as we travel throughout the country, we ask young people, what is their understanding on sexual and reproductive health and rights? And it seems like we are talking about a taboo because it seems like a big umbrella term that we've never had a chance to explain as young people. Thank you. So, as Siakwazi, in partnership with the National Population Unit as Abacha Dialogues, we got an opportunity to engage with young people in various provinces. And we did basic SRHR trainings where we actually unpack what SRHR is all about. So during the COVID-19, the promise of going in each and every area and simplifying the information, starting initiatives, kind of felt like it's going to die. But thanks to online platforms, we activated the SRHR talks, and I hope that after this discussion today, we'll be able to go out into our community, engage more on online platforms, and be able to help our panelists to further their discussions through their respective areas. Today, I'm going to start with Ntabiseng. Yes. We know during COVID-19, a lot has affected us. Mentally, we could not focus. So can you give us a brief, what was the young people's experience during COVID-19?
One condom. Yeah, I'm a radio presenter. That's how loud I get. One condom. One round. Young people, where are you? One condom. One round. While the whole country is opening the gate for John, I'm advocating for condomizing. That's what I'm doing. They can open the gate. I don't have a problem. But while they're opening the gate, Minister, we need to tell young people to condomize. Fully gate and condomize. Thank you. All right, sorry. No, I'll just tone it down a bit. It's okay. In the words of the resonant, newly crowned Miss SA 2020, is that better? Yes. So in the words of the resonant newly crowned Miss SA 2020, I quote, "We need to have a serious conversation about mental health, and we need to bring about change. I believe as social partners, we can tackle mental health challenges, but also bring about the change that we need to see." Close quotation. Ladies and gentlemen, my name is Ntabiseng Mahashwa, a 19-year-old young lady from Mpumalanga, who takes pride in being Siakwazi champion. A young girl who believes that she is the change that the society is waiting for. In order for us to make sure that we bring that change, as far as mental health, Jabu, as far as mental health is concerned, it is quite important to understand that it is an agent issue that all agents of change need to look into. Nearly 2/3 of TUT students in Mpumalanga, where I'm studying, they said in a survey that they took that their mental health worsened during the lockdown period. Because this is a time when a lot of people, Minister, were forced to go back to the drawing board, to be in a very confined space. We've been living in a very busy place, moving around. But during the lockdown period, majority of us were forced to now be in our own space. This is where you face your demons. This is where you face your skeletons. This is where you face your own reality. And a lot of things during that time were happening. I'm one person who believes that in order to solve a problem, you need to start by tackling the root. Because why? The gender-based violence that we are facing, that we are at the scourge of, if you look at it, now an article that was actually written by a young girl from TUT, which has not been proven, but she has made research. She said, most of the perpetrators that are perpetrating women molesting, raping, these are young men, or these are men that grew up being molested themselves. But because we live in a society where men are taught not to speak about these things, men are taught to bottle up these things, then they grow up with that thing. It's fixed in the mind. Then we get to a point where they do what? They actually perpetrate, molest, violate, and rape a woman. We need to tackle the root of the problem. The boy child needs to also be involved in this. Let me touch on something just very quick, I'm sorry. But also, during the lockdown period,
online was the new norm. The most saddening part about it is that every time you go on social media, there's always a new case about GBV. There's always who got raped when. Now that is not a positive space. Instead of young people being motivated, being positively influenced on social media, the only thing that they were reading about, one of the main things that they were reading about is these cases. It has been very difficult. And I'm speaking about cases that we have experienced myself, being a student at the TUT. So it is quite important that as young people, we look into this. Because I always say, in order to tackle any socio-economic issue within the SRH space, we need to make sure that we fix the mind. Thank you so much.
Wow. Thank you. That was a brilliant introduction, then Tabeleng, talking about perpetrators and victims. But I would like to go to Tracy Lee. Tracy Lee, gender-based violence in the Western Cape. This is a country on its own. Sorry, Minister. We must say it's a country on its own, and if you go to Kailicha, you hear a different story about gender-based violence, and you go to Parovale, it's a different story. Let's hear, what is it about gender-based that we young people are facing? Tracy Lee, can you just give us an overview? Is it on?
And I'm a gender-based violence activist. So before I start, I just want to correct everyone sitting here. When we talk about gender-based violence, and I'm going to repeat myself, you do not say a man. Gender-based violence, you refer to an attacker. A man and a woman can be an attacker. Because remember, we're trying to fight a stigma. So why are we creating it? Why are we saying men, young men need to learn? What about a woman? What about girls? Because then you're trying to push young men again from reporting what is happening to them as well. So please, from today onwards, you'll learn something new. Tomorrow you say, Tracy told me. And outside told you, yes, it's an attacker. Okay. So gender-based violence is a vastly undermined topic and pandemic that we have come to now. And the reality is that a society without gender-based violence does not exist. And South Africa is at no exception. As a young person working in communities, on the ground, experiencing these cries, these challenges, these problems with the young women and girls, the question comes at, why are we not reporting it? And when it comes to that question, they say, I don't know, or I don't want to. And when you go into that, I ask, why don't you want to? When we have health facilities, we have police stations that is there for us. That is our right. And then they come to the conclusion that they are not helping us. It's either there's a barrier, it's either they're judgmental, and it's either they're not capacitated with the necessary skills to handle these issues. So then my question comes to government and minister and whoever is sitting in the panel of decision making. We're signing that dotted line saying this is budget, this goes to this unit, this goes to NGOs, this goes to gender-based violence. My question to you is, what is being done? It's right, it's nice enough when you show all these beautiful slides about job creation, about what we're doing with gender-based violence, about the 1.2 million that was given for gender-based violence, about how you're going to help young people. And you guys asked a question earlier on, what was the demographics? My question to you as well is, have you asked us why don't you know what it is? Do not ask us what it is. Ask us why we don't know what it is. Because you're not creating platforms for us. It's easy to say it's on the internet, but when you refer to a young person, you cannot think of us as on the same mentality as you think of a grown adult. We do not know the terminologies that you guys, that old people, but I refer to all of you guys as young people, as the old people outside knows. We do not know those terminologies. We do not understand everything the way older generations understand it. So come down to our level. Sit down with us. Don't sit in your office on top and sign a dotted line. Okay, this goes to youth. Come sit within that police station where a young 9-year-old girl had to report she was raped. Come and show us where's the facilities that you created. Show us how you created youth-friendly clinics, youth-friendly police stations, youth-friendly health services that is our right to have. And young people sitting here, it's your right. It's your right to ask, I want to speak. You give me the platform to speak. It's my right. I am here because I have deserved to be here. So if you speak, you should make sure you heard, because gender-based violence is not going to end. If our grown-ups are not coming to our level, don't tell us the challenges. We know the challenges. You guys know the issues. We all know what the issues is. Tell us what you're doing about it. Sit with us and show us what you're doing about it. We don't want to see slides. We don't want to see words. We don't want to see money. Show us. You come here. Don't talk when it comes to COVID-19. Then you just want to react and call gender-based violence a pandemic. Gender-based violence has always been here. It never has gone away. Don't look for a reason to bring it to the spotlight when the world suddenly looks at us. It's here. It's real. We are crying for your attention, Minister. We are crying for your attention, DSD. We want you guys to come to us. Sit with us. And if I see decisions being made without a young person sitting there when that dotted line is signed, do not come to events and ask us to be there when you're not including us in decision makings. Gender-based violence is real. We need to tackle the issues, but you need to sit with us to see the issues. Come to the ground, and I thank you.
I saw someone I won't mention by name about to run out when I said, you young, older people, and then said, yeah. There goes gender-based violence. But I understand, Tracy, the need to talk, bring it to the ground. But I want to go to Nadine. Nadine, have we talked enough on the LGBTI community, on gender-based violence, access to SRHR? What is your perspective? Yes,
I am Nadia Heman, as you've all heard. I am representing the LGBTIQ plus community. I'm from the West Coast, and yeah, as you were asking me, Jabu, I don't think, in my personal opinion, that there has been spoken enough, especially about the LGBTIQ plus community, because I've been to our healthcare facility in Elands Bay the other day, and I had to wait outside that clinic for about an hour and a half just to get one HIV test. Just to get one HIV test. And I went in, I then asked the consultant that why did it take me so long just to get an HIV test? And then she said to me, but we have to follow certain safety protocols and what, all these kind of things. And I said to them that I was here, like, I went there like around 1, I think. I came out there at 2:45. So I then said to her, but an HIV test takes 15 minutes, right? So then now, why should I wait outside this clinic just for one HIV test so long? And then she then said to me, but we like I said, we need to follow all these certain protocols and so forth. And in my personal opinion, what I see is that what I've realized on that certain day, and I took it in a personal way, is that when it comes to us as the LGBTIQ plus community in our townships, it's so difficult to get access to certain things or to be qualified for certain things just because we are who we are. And I believe to say that they need to improve that. We need to break that cycle of how people see and think of us, and also they need to I'm not going to say it's your right to judge, because it's not. But it's also not your right to bring me down to a level where you don't want to be. Do you understand? So put me on the level where you want to be and where you want me to put you. Do you understand? So, yeah, that's basically all I need to say. Thank you so much.
I hope Honorable Minister are taking notes. They are not staying in my area. Elands Bay, I have not been there. I don't know which direction. I'm from the Western Cape. This was not rehearsed. Talking about access, and it's key because it affects everyone. I want to give to Nolu Tormenta, giving us the Eastern Cape's perspective. How is access to SRHR services within her community? How are things going? Can you guys hear us clear here at the back? Oh, thank you.
Good afternoon to my elders and to my youth, and thank you, Buchabo. It's a challenge. It's been difficult. First of all, to go back to Thing's point, she said something that we should use condoms. Too bad for us, people of Utenek. Utenek is outside PE, so there's a difference, a huge difference. We don't have condoms in our clinics. So how are we going to protect ourselves if there's no condoms? And we've got 2 clinics in my area. And I'm staying in Kwalanga. Kwalanga, it's part of Rosedale. So we don't have condoms. How are we going to protect ourselves? And there's another thing that when it comes to family planning, clinics were closed for 3 months this year. We couldn't go for family planning, and we are late our dates. So when I went to a clinic to go for family planning, they asked me to do a pregnancy test. And they turned me away and said, come back tomorrow at 8 o'clock. And when I come back at 8 o'clock, they told me that they don't have a pregnancy test. I should go and buy myself a pregnancy test and come back to the clinic. Bear in mind, a pregnancy test, it's 20 rand a clips. Bear in mind, I took a taxi to go to the clinic because the other clinic is closed. So I went to go to town to another clinic. So I took a taxi there. So I went to buy it and then come back to the clinic and did the test. And then there I got help. And another thing, the other clinic is now open. That one that was closed for 3 months. And it's open, but you are not allowed inside the premises. You have to stand at the gate, at the fence. The nurse will come to you at the gate and ask you, what's your problem? What's wrong with you? What are you coming for? And there's no privacy there. If I came for doing an HIV test, so everyone is going to hear about status now, because I'm going to have to be held at the gate. So as young people, this year has been very difficult for us. Very difficult for us. And bear in mind that standing at that gate, you have to stand for 3 hours. Whether you're young, whether you're old, even old people are sitting at the gate for 3 hours, for 4 hours, and then they're going to be told that we're going to deliver your medication after 2 days. But you've been sitting there the whole day. I thank you. So sorry, before I give it to you, I have a question to the minister, to the government up there, that what are the measures that they have put in place of curve? Thank you.
Okay. Hold on.
Can I repeat it?
Gaitete as close as equivalent.
Okay. Umbuzo wami uthi abantu abaphezulu pha kwi-government, kwi-ministers, that benze ntoni ngobe kuplanwe le COVID-19. Injongo zazo to ulungisa ezi zinto, usinike i-chance uba sifumane ezi zinto. Yintoni into abayenzileyo, and ndineshore into yokuba ngaba zikhona into ezibhaliweyo ezigqityiweyo, ezi-noted down. So ke kulungiswa njani?
So Bambi. Okay,
Thank you.
Please translate to the nearest person the question. Later on, I'll ask for subtitles to run. I think my panel is writing hot now, and I'm thinking we are talking about access to this. But was the information on SRHR ever enough? Was it disseminated enough? So how was the communication on SRHR information throughout COVID-19.
Jabu, thank you very much. Comrade Leadership Minister, all prestige guests, thank you. Particularly, I best believe that I'll be addressing the communication on that, but to start off with what Nolu just said, I still see that the government need to literally focus much more on youth-friendly services, because we are toning it to, imagine me going to a clinic where I now have to talk to Mama Tepo, and Tepo is my friend. You see, so when I meet Tepo, Tepo already knows. Because one thing about our medical system, especially under SRHR, is that the Batopele principles are neglected these days. They are not taken as serious as they were back in the days. But in any case, that is what we are now conforming to. But it's very sad to see that our elderly people had the quality of health that they experienced in their days. But when it comes to us, because of the times have changed, now we have to conform to that ourselves. It's quite much stressing for us too. But in any case, looking into communication, I would want to say, firstly, in the Northwest, as a province, there was too much negligence on that. And I want to say that the negligence that comes, it comes with, the government or any other institution handing out information, but not literally tapping into, young people to understand. It's easier for you to give me a flyer. It's easier for me to read it, but the question is, am I understanding what I'm reading? And also, to what extent is that flyer addressing me? Is it just telling me to go and test for what? What is a test? There's other young people who are still not yet, availed in terms of this SRHR injustices. But in any case, looking at it, there is need for that, because when you're looking at COVID-19, in any case, there was so much negligence also on media. We were not being addressed in terms of, safe termination of pregnancy, your teenage pregnancy on its own, and your HIV and AIDS test and everything also. Because I just came from one engagement just now with the World Health Organization, and my biggest argument on this is that we young people have the knowledge that we need to have about anything that has to do with the medics. A young girl coming would be advised, show me, get all depo. But this friend doesn't even know what depo looks like, doesn't even know the dosage that you're supposed to take. You don't even know the rightful measures for it. You need to firstly understand your body type, your blood type, and everything else, so that it does not react in any other way. Because we always talking of this thing of saying, one thing about contraceptives is that they only have to put you away from pregnancy, not anything else. Weight gains and heavy menstruation and everything else, those are some of the myths, but they come also after not knowing what body type you are, and you just taking things as they are. Hence I'm saying youth-friendly services is someone else coming to me and saying, my brother, this is my problem. We talk on a youthly basis, as young people. But now we so much moving away from that, because a lot of other communities, when you check Northwest, the Dr. Roof Mompati district is running short of a lot of resources. Our own Dr. Kenneth Kaunda district is literally just running off a lot of resources. But now the most important thing also is that when you're thinking of communication from the national sector going to the district, you still have to jump into the provincial, and there's filtering of communication that goes down. Is there a way in which government is going to put in place the remote way of sharing information much more quicker and in a more advanced way, of us not being able to need data, of us not being able to need other expensive resources for us to access the data that we need. So I best believe that for now, my question would be to the minister and the committee, what, looking into the 4IR and what we are growing into, what are the plans which are put in place for us to literally get to access the information that we need under SRHR? Because in that point, I can never do anything that I don't know of. Literally, I will always be on the negative side of the route. At this point, we're having a surge in every state. You're speaking of teenage pregnancy, is rising. You're speaking of unsafe termination of pregnancy, is rising. You're speaking of anything else that is under SRHR, is rising, because the information that is given, it's either filtered or it does not communicate to the young people. You see, you find posters. Those posters, get Jabu for them. Jabu is old. I don't even look at it because Jabu is old. But if you see Tolo, hey, he's handsome, I'm going to look at this one. You read it. You see, so we need to find a better marketing strategy of how do we reach out to smaller communities also, because now we're speaking of this, but there's someone coming from Haranku or somewhere where the clinic is not even accessible, whenever anything happens, these people have to wait 24 hours before they can access their clinics or anything else. What other plans are put in place for us to literally access the communication that we need, and the marketing also? How diverse is the marketing of the DSG towards the communities? Thank you, Chair.
Thank you, Tsolo. And a point of correction, I'm only 28 years of age. I'm not that old. I'm not that old. Yeah, filtering of information, and information being simple. You know, we had a campaign of taking down all these illegal abortion posters, and it was a success. We need to be really proud of it. Now we need to take down all these posters of penis enlargement and put SRHR posters, because it seems like it's taking all the bus stops and buses. But talking about youth-friendly services, I would like to give it to Sis Noltando to give us, when we talk to young people living with disabilities, what is it when it comes to youth-friendly services? Does it talk to them? Does SRHR talk to you as a young person living with disabilities and youth-friendly services?
Hi, everyone. My name is Nolutade Makalema. First of all, I am very disappointed, number one. Why I am very disappointed? I only see only two. Sorry. I am very disappointed, yeah? because ndibona only two yabantu abane-disability, which is ndim nalosisi, which is, to me, it is so unfair. That is number one. And then number two, and then also I've got so many questions ku Minister Wetu. Number one, before all of this, I think you knew that there will be lockdown, and then and then like for us as abantu disability, because if ever we are quick clinics, we go there and then people will be like, why are you here? Why can't you stay at home? Because you can't work, because you see that. So I've got a big question. So I've got a big question. In order for us to be accommodated clinics. Number three, Tina, as abantu with disability, we are so violated. That is our big stigma, because we go there and then people will be, and then people will, but then abandon as if, you see, that is our so that is a gender violated to us. Even if you are working with a wheelchair, people will always be like, ah man. You see, so we've got a stigma in GBV. Also, according to health in clinics, I think a lot of you will see us being pregnant, and then you'll be like, but why are you so? But why are you pregnant? Do you know why? First of all, we don't work. Number one. So people will. And then I will vote you with money. I will do this. I will do. And then mina ngizovuma okanye kwantene angiphangeli, and then imali yami grant ayikho enough, you see. So that is also our issue, because we are not working. We can't get more of facilities to help us. So my point is, as a government, as SDD, as social development, what is the facilities that you did? What is the research that you did for us in order for us to be helped as abantu abane disability? Thank you.
Bacinga sithandani sesinolthando. Ya sithandani sensilale emadongeni thina. So we've heard our panelists and the great points they are making. It is really saddening that really we are still living in a society that judges, that undermines human dignity, even depriving one's beautiful gift of love just because of their physical or disability they have. Now I'm gonna not be selfish, but time is not at my side. I just want just two people out of the young people. I'm not gonna be selfish. Please don't make it long. Give us your question or experience, and we're gonna wrap up our discussion, because I think the young people have said a lot. We need to sit down, do some introspection and reflect, and hopefully when the minister talks to us, we touch base on our experiences as young people. So just by show of hands, so that we can quickly run into the crowd. I see a hand at the back. Hey, now I said 2 and then 3. Okay, I'm gonna acknowledge the first hand that went up, and then Usisi here. Yes.
Okay. Good afternoon, everyone. Sorry. I heard all the stories, all the experiences. I heard everything. And also, so in Anakita, excuse me, also Siakwazi, and in my community, my experience. That's also what's happening in my community specifically and currently. The rape cases, the hijacking of kids, all those kind of things, etc. It could go on the list. So my question is, how can we improve in our health facilities and police stations the barriers? How do we think, how do we or you or whoever up there think we can improve the gender-based violence services that are offered for young women?
Okay. Thank you.
Oh, hello. Hi, I'm Asanda, also from the Disability Forum. My question is, like for instance, when we're going to public clinics, for instance, family planning, sometimes they'll, why you here for pregnant, for injection and some stuff. So my question is, how about a government develop a youth-centered counseling care and rehab facilities for accessible without parental constant. Thank you.
Okay, Elsie, we are with you.
Greetings to the Minister and and the panelists, and to everyone that is here today. So I'm a panelist here too in the front have mentioned quite a lot, covering issues surrounding the LGBTQI community, mental health, and so forth. But what I just want to know is, are there any training services for abantu who are public servants so that they can be more sensitive to the issues that people are facing? Are there any services that are going to help them and train them? Because at the end of the day, we are all human and we need to learn. So a nurse going to nursing school and just, sorry?
No, I'm pointing
A nurse just going to nursing school and just learning how to become a nurse and what treatment to give a person. They need more than that. But a certain situation ihandlishwa kanjani. We need these type of services, and they would really help in almost each and every one of these issues that these young people have mentioned. What are there any services put in place, or will there be any services put in place to try and combat this? Thank you.
Thank you. Not that the security is asking me, what are you doing here? No. You must tell the security your condition.
Hi everyone, my name is Michonne. I just have one, I don't know whether it's frustration or confusion or irritation with regard to you as a community advocate working outside in the field, in communities, in clinics, working with people living with HIV, try to get them back on treatment, the defaulters, do home visits, door to door, but then these days that you come by the clinic and you have the default list and try to get the people back on medication, and for some reason there's no assistance from the clinic side. According to them, we are difficulting their duties, we're making it more duplicated because they refuse to work with the one clinic, the transfer from the one clinic to the other clinic, because sometimes it's gang related, it's gang violent, and that is part of the reason why the people are defaulting also, because due to the gangsterism and also stigma around HIV. Because sometimes in the clinic side, there's a certain area where the collections paid for the medication, and that is also the reason why they don't want to go fetch the medication, because of with the community, the stigma and talking and so forth. So my frustration is, as a community worker, is how can we make it easier on ourselves if we don't get really that help from the health workers?
Okay. Thank you for your contributions. And I'm very short, so I'm gonna be short with the usage of time. And I'm gonna respond. I see you're edging, so what I'm gonna say is your communication during that, when we can extend the communication when we are dealing with that one. All I can say as a response is that Siyakwazi Youth Network is for young people, by young people, for young people. It is a platform to unify young people's voices and come up with initiatives, campaigns to combat social ills when it comes to sexual and reproductive health and rights. So it's about time that we understand that we've got these issues, and then what do we do with it? So it's about time we start working. We've got the t-shirt now, let's work for it. So some of the questions I won't answer in my capacity, but I'm sure when the minister addresses us, she would touch base on some of the issues that have been covered here. Thank you for being a wonderful audience. Please give yourselves a round of applause, and thank you to my panelists. As we are preparing the podium for the minister to take position, can we please have our last video being played? Thank you very much. And please, after the video, welcome the Honorable Minister Lindiwe Zulu. After the video, thank you very much.
A message to young girls experiencing your menstrual period for the first time. Your school may be closed, but life goes on. Your classes may be suspended, but learning never stops. Certain things will not wait for schools to be open, your teachers to teach, or classes to resume. And one of those are changes in our bodies. When we are between 10 and 15 years old, we begin to notice certain things happen in our bodies. Some girls develop breasts, some boys develop deeper voices, some girls and boys develop pubic hair and even beards on boys. Do not be scared. This is all part of growing up. Even adults experience the same changes we later on. The most important change for girls is that they will begin to experience menstrual periods. Menstruation is when girls see blood coming out of the vaginal area. Before this blood, you might see vaginal discharge on your underwear. All of this is normal. You are not sick. You are not infected with a virus. Speak to your parents, caregivers, and other adult people you trust. When you start noticing vaginal fluids, be aware that your menstrual cycle has begun. Always be prepared and keep a sanitary towel close by. Above all, do not worry and do not panic. It is all part of growing up.
Chulamtana, 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 kalelani. Chulamtana, thanks. Chulamtana, chulamtana, when you kalelani. Chulamtana, when you kalelani. Chulamtana, when you kalelani. Chulamtana, 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 when you kalelani. 16, 16, 16, 16. My sister will have to explain to you the 16. Bopa, bopa. Yes. Thank you so much. It's just that the time and this COVID is making life a bit miserable for us because we could have been able to be here much longer so that we can have an in-depth discussion, because I never believe that it's a one-way process. It's always a two-way process. We don't come to you just to talk. We come to you also to listen to what you have to say. But we also don't come to you to listen to your problems. We come to you because we also feel you have solutions to the problems. That's why for me, it's not a one-way trip. It's not like a lecture. A lecture is when your lecturers are in the hall and then they come to tell you that in literature there's this book and that book that you have to read. But when we are here, when you are at this platform in particular, even myself as a minister, some of you guys make a mistake of thinking like we woke up yesterday and became ministers today, and then we didn't go through certain things. Like the things that you are talking about here, we didn't go through. We went through them. Actually, we went through them even much more painfully than we see today. Because when some of us got pregnant at 15 and had the first child at 16,
the same questions were being asked even then. Why are these adults not talking to us? Why are these old people not talking to us? It means there's something that we need to break as a nation. Break the divide. There shouldn't be a divide here. I should be coming here to share my experiences with you, not only from a government point of view. Because when all is said and done, I might be a minister, but I'm a human being first and foremost. And being a human being, I've gone through exactly what you guys are going through. But it was what did I do when I was confronted with the same problems that you are confronted with today? The question is, what did I do about it? And all protocol observed, may I say, but of course, our UNFPA country representative, Miss Beatrice Mutali, is very important to me, firstly as a woman, but secondly as an African, because sometimes we take it for granted to think that to become a UNFPA country rep, somebody wakes up in the morning and decides you've got to be that country rep. She can stand up here and tell you how she got to where she is, because these are some of the positions that for many years were never even held by women. So it is a celebration for us that we have women at that level. And the reason why I'm raising the issue of this being a two-way process, it is because she can also tell you about her own challenges in her own country and how she grew up and how she fought to be here. How her own parents couldn't talk about the things that me and you are able to talk to you about today. Me and her didn't experience see these things that you saw here today, don't undermine them. The videos that you saw here, because these videos are meant to be a tool for communicating. They are meant to be a tool that actually sometimes helps you not to engage with somebody that is not very willing to be open with you. And you see here, they talk about menstrual cycle, talk about reproductive rights, talk about those things. Me and her, nobody spoke about to us about those things. That's why I fell pregnant at the age of 15, and I thought I was very excited. I'm in love, somebody loves me. Yeah, I got pregnant and he dumped me after that. That was the bottom line. Now, what we need to talk about is, why is that still happening? Why is it that 40 years ago or so, or 41, 42 years ago, I got pregnant at the age of 15, and you guys are still complaining about the same thing that happened to me 40 years ago? What is this? So as a nation, I believe we have a lot of work that we need to do. And so the people who are here today, from Siagwazi Youth Network and Partners in Sexual Health, to Lulwazi, Luetu, right in front of me sitting here, to Kailicha Development Forum, to Partners in Sexual Health. Why are we here? How did we get here? Did somebody come from heaven and said we must come here? No. Somebody thought of it. Somebody did something about it. Somebody pulled resources into it. Somebody woke up every day to say, UNFP has agreed to partner with us to do the following things. All the people that you see here, they didn't fold their arms. They got up and they said, there are challenges that are faced by the young people. There are challenges that are faced by everyone here representing different structures of your areas of work. But for me, it's the fact that you yourselves stood up, woke up, and came here and sat here and are able to speak. That's how nations are built. Nations are not built by people pointing fingers and kicking and doing all that. No, no. Nations are built by all sectors of society, starting with the young people, taking interest in what is happening to them and then saying, what are we going to do about it? That's how it happens. And you see, I might want to take you back to my own time of 1976 for those who are older, who were here at the time. There's not many of us here, by the way. There's not many of us here. So that should say something to you. I think there's only 2 of us here who are 76 generation. Let me see the hands. See, it's only 3 of us, or 4, 5, yeah, 5. There's only 5 of us who are from that 76 generation. And the entire room is full of young people. And so I want to say to you, there is no nation in the world that undermines other generations that came and brought us to where we are. It doesn't work that way. Neither does it work that way that that generation that has taken us from where we were to where undermines the capacity of the young people who are sitting here. Doesn't work that way. So as a start for me is to say, I hear you loud and clear when you say nothing about us without us. You might have not said it directly like that, but I can take it back for you because some of you were not even born then, probably, when it happened. It was people with disability, way back pre to 1994, when we were writing the Constitution. And they could see that even there at the Constitution making process, they were not represented. In fact, it was worse at that time because under the previous regime, under apartheid, people with disability were hidden. Not only were they hidden by the system, but they were hidden by our own communities. We did not want ukuthi kwaziwe ekhaya ukuthi no kithi khona umuntu oso. We're hiding it. We're not wanting people to even see them on the street. But we changed that. We changed that and we made sure that people with disability, as the Constitution was being written, so that their rights are also enshrined in the Constitution. We changed that. And I'm saying we changed that because I know we were there. We were women under different women's organizations. And I was a woman under the Women's League, ANC Women's League. Hey, you know at that time, when you spoke about LGBTIQ+, it wasn't even called this. It wasn't called this name. There is a name that resonates with them today. When we went to write that Constitution, they called all kinds of names. In fact, they were almost saying, Khanis fihlile. But that wasn't the case. We were wanting these rights to be enshrined in the Constitution because we believe their rights are human rights. Women, phela kumnandi today. You guys can sit here and can talk freely. You can do whatever. At our time, we had to go and fight at the Constitution process, negotiations process. There were no women. We had to go and demonstrate there and almost break the wall down just to allow women to be part and parcel of the negotiations. Your Nkosazana Dlamini Zuma that you see today, your late Mam Winnie Madikizela Mandela, your late Masi Sulu, all the ministers, in fact, most of the ministers that you see there, they will tell you this history. There were no women in the negotiations, and we demanded for women to be there. And we said, any of the political parties who are there who do not want to have women in their delegations, they must put an empty seat somewhere between the men to show that they do not have women and they don't want to bring women. We had to do drastic things in order for us to be accepted there. So, when you say to me, you want us to come down to the ground, you want us to not treat you like you don't matter, you want to make us feel that we are partners, and you, as youth, are at the center of these things. That is the reason why we are here today. And I want to say to you, for us as a Department of Social Development and for us as a government in general, we never want to have events in order for us to deal with your issues. We want all the organizations that are here, whether it's Lulwazi Lwethu, whether it's Because We Can, all these, we want these organizations, we want to empower these organizations to be with you on the ground. Because if we think the Minister of Social Development and the department at national level is going to be able to come down to the ground all the time, we will never be able to finish the work, because the entire nation, I'm with you here, some in KZN are upset with me, some in Free State are upset with me, some in the Eastern Cape are upset with me because they're saying, why are you choosing those ones and not choosing us? It is for this reason, therefore, that as a government, we think it's important to strengthen the local structures, local government and provincial governments. And it is a fact. We distribute, Peter, money from the purse of national government to the provincial governments. It's called, there's the name for the allocation to the provinces, man. Equitable share, I'm looking for lelo gama ngesingisi. Equitable share. And that equitable share is also informed by the population of the provinces. So the one that has got more people gets more, the one that has less gets less. But now I'm talking just about the Department of Social Development. The entire government does that. If you go to the COGTA, they will do the same. If you go to education, they do the same. So the reason why, for instance, President Cyril Ramaphosa in this particular case decided that let us focus on district development. Because when we focus on a district, I must know that in district so-and-so, how many people are receiving social grants. I must know in district so-and-so, how many women live there. I must know in district so-and-so, how many youth are there. But I must know what are the services that are needed for them at a district level. So this issue that you are raising here with us to say, you are not reaching us, you are not, the clinics themselves are not servicing us properly. And you, somebody rightfully said, do you teach the people who are supposed to serve us? Do you have training programs for them to understand what they are supposed to do? That's the reason why we came with Batupili. The importance of people, because as people who are serving, you're not supposed to be serving yourself. You're supposed to be serving the people. In fact, you're actually getting paid for serving the people. And there is training for everyone across the board, whether it's teachers, whether it's police, whether it's social workers, whether it's everybody. There is a department here, public service. Part of what it has, it's a whole institution for training people. What do you mean when you are supposed to serve people? And it is for this reason, for instance, that we say civil servants or civil service. Civil service is about you taking that job because you understand the needs of the people. It's about you taking that job because you are committing yourself to being there for those people. So when young people say to us, come down to us, let me tell you, the coming down starts with the councillor who is there. The coming down starts with the mayor who is there. The coming down starts with the MEC who is there. The coming down starts with the premier who is there. When we were planning government, this is what we thought would be best. Have the 3 spheres of government. I'm not sure what's happening. Might be phones. The 3 spheres of government was meant to help us so that you get your service immediately. But we must accept that while we were preparing that, while we prepared the structures to be there, we did not power the local government enough. That is why when you go to a clinic, you get a frustration and you don't know who to go to. And the first thing you think of the minister. Whereas actually, in that clinic, when they are not serving you well, the first person you should be asking from is the councillor. When the police station is not serving you and not creating the conducive environment for you to come and report, the first person who is supposed to respond is the councillor, the councillors, because it's not one councillor. I actually wonder if many of you know who your councillors are in your area. Do you know? Let me see those who know. Yeah, not bad. Yeah, not bad, not bad. At least you know your councillors. The only way your councillors can function is when you keep going and knowing, how do I report to the councillor? How do I push for my issues? If the councillor cannot serve me, what is my next recourse? And the funny thing is that all of us has got the power of the pen to vote for the people that we want. So even here in the Western Cape, when people talk, and the program director said it here, that this is another country. And by the way, they just said it the other day, the other people, I don't want to be political here. They said maybe it would be better for the Western Cape to be a country of its own. And they said that not with shame, by the way. I'm not saying something that it was on TV. They were saying, yeah, maybe the Western Cape. And then you ask yourself the question, here you guys are here, you are in the Western Cape. Not all of you are from the Western Cape. And we have to ask the question, the money that we give to the Western Cape in the equitable share, can somebody tell me where does it go to? Where does it go to? And it is you who are supposed to ask that question so that it doesn't become a political issue, that the only reason why Minister Zulu is raising it is because she's a member of the African National Congress. It is a fact. Go to Khayelitsha, go to Gugulethu, go to all the areas where there's either all the black people live, go and see whether what is said in Parliament that here we are better off, we are better than Mpumalanga. I traveled the entire country. And I can see the difference. We are not where we are supposed to be. But when I go to KZN and I meet with the MEC and she takes me to the places, to the homes, to these places where the money is being spent, I get to this home and I see, yeah, they're talking about food parcels. I can see the food parcels are there. Or they're talking about this. So, what I want to say to you young people, it's also in your hands. Please do not think somebody is going to come from heaven and help you walk through, open the sea and walk through. The person who has to power himself or herself starts with you. Starts with what you do in your area where you are. It starts with you. Government can have the best policies, the best of this and that. You're not going to eat that. You're not going to live that. Our role is to create a conducive environment for you, which therefore means where there's supposed to be a human settlement, it's got to be human settlement. Where there's supposed to be water, it's water. Where there's supposed to be transport, there's transport. Where there's supposed to be bridges, there's bridges. In 26 years of our democracy, it was not possible for us to turn that over within 26 years. 26 years ago, there was one country called South Africa. It only became one country in 1994. Prior to 1994, there were 9 countries. Do you guys know that? There were 9 countries. Well, because they are supposed to be the one who are answering that. If you traveled from Free State to Bophuthatswana then, Orange Free State into Bophuthatswana, you needed a passport. If you travel from Western Cape going to Vavenda, you needed a passport. 9 countries in one country. And so when we started, we had to break that down all and create one country. So, the issues that we're speaking about here are not just about issues that came because of COVID. COVID made it worse. And when people with disability, for instance, do not have access immediately here when the clinic is not here, you can understand, you can imagine what that is. But the shame is when even they get to the clinic, somebody has got the freaking mind of saying to her, why are you pregnant? What is that? That attitude is not an attitude that can be dealt with by government alone. That attitude can be dealt by human beings being humane towards each other. When people of the LGBTIQ plus go to the clinic to go and ask for help, it is their right, for God's sake. Live and let live. So if we are not one of those LGBTIQ people, why are you worried about them? Because I need now ungaphila impilo yakho. Nabo bayeke baphila impilo yabo. Why do you want to interfere with what they want, what they need? The Constitution of South Africa covers everybody. So, it's in the mind that needs to be sorted out. And so, the research that we are talking about, for instance, it is supposed to be research that highlights those issues. But you can highlight those issues 1,000, 1,000,000 one times. If you can't change the mindset, you will spend money producing your documents, which are very necessary, producing your documents, but if you cannot influence the behavior of our people, the thinking of our people, we will never be able to deal with the problems that we are talking about here. You talk about youth-friendly services across the spectrum. I fully agree with you. Social development is about the well-being of people, irrespective of whether they are disabled or they are whatever. Our responsibility is to every individual in South Africa and every citizen. But we pay special attention to the most vulnerable, because those are people who even under normal circumstances they could have helped themselves, but they can't. Transport, yes, she is. She's walking in using that stick. I can imagine how long it takes her to move from home to wherever. Unless she came from a home, maybe there's a car they can buy. And I'm 100% sure many of us and in our black communities, there's nobody who's going to have that amount of money of buying that car. So she is going to be forced to walk like that. And again, it's in the mind of our people. When they see her, shame, she doesn't need that. She doesn't need that. She needs us to create a conducive environment for her, and we talk about the fact that you can't get jobs. Who said she doesn't want to work? Who said she doesn't want to go to school? Who said she does not want to have a child? Who said she doesn't want to have a boyfriend or a husband or partner or whatever you might call it? You know who said so? It's society. Some of our own with that kind of a mind that says, oh, if we are looking like this, we are this, and therefore you deserve the following. Or if you look like this, then you don't deserve it. I'm saying to you, young people, it is not going to work if we are going to get into a boxing match or a boxing ring. It is not going to work if we are not going to be tolerant of each other. It is not going to work if we don't create environment around ourselves and demand. When government says we're going to do the following thing, it's your responsibility to go and demand for that. When the councillors and other people are not available, it is your responsibility to get up and say, we're going to demand for it. And when I say to Peter, we spend 7.9 billion rands per year giving it to NGOs and NPOs. But I'm sure many of you here are not even aware who are the NPOs in your area who have been given money by the government to assist you. And all you're looking at is, so we're going to get that minister when she comes to us. We're going to get that minister when she comes to us. I don't have a problem. Get on to me. Ask me the hard questions. I will respond. And where I can't, I'm going to tell you, guys, I don't have. The officials maybe might answer it. But it's your responsibility to do that. I'm asking Peter, 7.9 billion rands per year goes to NPOs. Where's the value for that money? 7.9 billion per year goes to organizations who are supposed to help us on the ground. And I'm asking Peter, I am not wanting to accuse them of something wrongly, because there are many of them who actually you can go on the ground, you can find, you can see, you can feel the impact of the work that they are doing. But it's important for us to relook, how are we doing that? I also want us not to depend on events. I'm telling the department, it's good for us to have events, for me to come and speak to events. You know what I'd prefer to do? I'd prefer to say district so-and-so, district 6. Let me just make an example. I prefer me and my team to go there and do door-to-door. Door-to-door. I prefer to have volunteers on the ground who are going to walk with me door-to-door. I prefer to, because when you go door-to-door, you're going to be able to know what's happening here. This family might not tell you, but the neighbor will tell you, we hear the cries in the night. Somebody might not tell you, but they will tell you that police station is nonsensical. The people who are in that police station are not doing the right thing. I've said to the department, now that the president has said to us, we need to do district development model. I said to the NDA, your National Development Agency, you were able to mobilize volunteers for COVID. Why can't we mobilize the same volunteers for GBVF? And I'm saying to the department, we're able to mobilize resources to respond to the pandemic. Why can't we do the same thing and respond to the other pandemic exactly the same way? Because government overall and the private sector were able to shift funds. You know why we're able to shift the funds? Because everybody was afraid of COVID-19. And I'm asking the question, why isn't everybody afraid of the killing of women and children and young and the LGBTIQ communities? Why can't we do exactly the same way? Not social distance. Not social distance is keep the distance. Keep the distance. Even from an abusive point of view. Why can't we say, let's find a way of keeping the distance? So, the same way that we're able to have the command center, the NCCC, and all the things that we did, By the way, there's something else that we did. You see that young man sitting there? When the president agreed on the 350 to pay to people who are unemployed, nobody went to SASSA office, not one person. Everything was done electronically, telephonically, WhatsApp, and everything. Why can't we then maybe turn this thing around and say technology assisted us to do the following things? How can we make sure that technology helps us to make sure that people who are suffering or who are beaten up, there must be something that they use quickly to get there? There was a number there. There were numbers that were there. But the issue is, those numbers, when you call them, how quick do you get the response? Those numbers that you called there, when you get the response, how fast are you going to be saved from your situation? And therefore, that means local structures, local government. Local government must be strengthened. Local government must respond. Local people must respond, because mina ngu minister at national level, I can be called by 9 million people who applied for SRD, but am I going to be able to respond to the 9 million people? I'm not going to be able to do that. But the local structures can be able to respond to that. So I think what is very important for us, and especially the research, you see, I don't believe that research is done for the sake of research. Research is done because you have to have empirical evidence so that then you can develop effective interventions. Because if you don't do the research, then we are without really responding properly to the people. And here we are talking about rights. Rights that we are always fearing talking about. Nobody wants to talk about menstruation. Nobody wants to talk about the reproductive rights. This morning I went to a place where there was a young man who said to me, Minister, until you call it what it is, you will never be able to deal with it. He says, go there and tell each and every individual that they came through a bleeding vagina. And he says, Minister, I was in Kailicha, or he was somewhere where the minute he said that, the men in that room wanted to chow him alive. Because they were like, what are you talking about? But he says, Minister, that's the truth. That's the fact. Nobody is born any other way. There's no stock here that comes carrying a baby and dropping the baby. Those days of telling young people and telling children there's a stock that's going to come, and with that propaganda, you even see the stock flying with a baby in there. There's nothing like that. There's only one route for people to be born. They have to conceive. Somebody has to conceive, carry the baby for 9 months, give birth to that child, and it's as simple, straightforward as the young man said. The young man said, it is also your fault, Minister. You people, you conform to societal language. So you make it difficult for these young girls who are here with me now. For me as a man, he says these girls came in here, they were even afraid of me. And yet it is me that took the decision to say there must be a place that is decent for these girls who are coming from, who are 18 and over. He's trying to fill that gap. So we have to tell it exactly like the way it is supposed to be. I know there is a speech here that I'm supposed to go through, but I've picked up some of the things that have been raised, that have been said in the speech. But in conclusion, what I want to say to the department first and foremost, let us, as the young people said, let's go down to the ground. Before I came here, I went to visit a home that has got young girls, and they were very excited to see me there. We sat down, we had a conversation. So, government, in the form of the 3 spheres of government, also let there be an appreciation and understanding. What is the role of national? What is the role of province? What is the role of local? Then we won't conflate things and start asking questions wrongly. What you are supposed to ask at local government, you are not asking, you don't even know who's there, you don't even know what they do. And the MECs are there, you don't know what they do, you don't know what they are about. You are only thinking that the only person who has to communicate with you is the minister. Yes, the minister must take responsibility where the minister needs to take responsibility. But there is that angle that says, who can give us the services that we need of immediate? National has a responsibility of monitoring and evaluation and checking as to whether the two other spheres of government are actually serving the people or not. That's our responsibility, and we have to do it. But to the young people in particular who are here, I'm going to ask you that in your areas where you are, be the change agents. Be the ones that make the decision and look around and say, first and foremost, let me fix myself before I can think I can go and fix somebody else. But once I've fixed myself, it is so easy to then go out and say, can I help you? Start with helping yourself first. Empower yourself with all the necessary information. And you guys are in a better world. We never used to Google, me and the 76th generation who are here. We put everything in the head. When it came to geography, we had to cram everything. When it came to mathematics, we had to cram everything. When it came to science, you didn't even see a beaker and a Bunsen burner. It was drawn for you there. You guys, you go to laboratories. The Bunsen burner is there. The beaker is there. The chemical is there. Runa, we had to cram even the chemicals. Okay, me, at least I was a bit privileged. I went to school in Swaziland, so I saw the Bunsen burner, the beaker when I started my Form 1. But I knew that those who are there at home where I come from, they draw it up there, they put it in their head. The chemicals, I could see the chemicals. They could never see the chemicals. And you guys are in a different world altogether. You Google, you go to the library, I'm sure I'm a library, you go to libraries and you go to all those places, you can practically see these things. So, can I not have any one of you thinking that when there are issues and terms that are being raised here, we are raising them because we are adults, because we know? It's not true. We know those terms because we work on those terms. But many a times, we work on those terms because the circumstances of our work forces us to do that. So guys, I was very disappointed when nobody could respond just to the economic plan. That doesn't need somebody to be teaching you about the economic plan. You should be asking yourself in your area where you live, what is it that I can do to make myself live here? What can I do? Is there any small business around here? Is there any cooperative around here? Those are the things that you have to help yourself with. So please, your ignorance, don't blame your ignorance on somebody else. Get up, wake up, find out the information, get the information. You see, you lost here 300 rands, 500 rands, 300 rands. I mean, I Googlisha very fast, old as I am. The minute I ish on very fast, in fact, I would have been here, I arrived here, and I didn't have I also have to count my data and all that, even though I'm a minister, I have to take the responsibility. But everywhere you go, you say, how do I get into this? How do I get into this? I'm not taught by anybody that. I was born before the computers were a big thing in Africa. I only did computer appreciation only in 1986. Think about it. But I never went to class for it, by the way. I never went to any class. All the things that I do, computer, even the computer I'll read. I wasn't taught by anybody. I looked what people were doing, When they were logging in, I looked. When they were turning on the computer, I looked. When they were putting passwords and all that, I looked. Because there wasn't time for me to go to class for it. But I told myself, they are not going to leave me behind. I'm always going to be in the front. I'm in Instagram. Where I went, yes, where I went this morning, that home that I went to, Graceland, I found that guy, he followed me, and I thought, okay, there's following, we like. And then he kept on writing there, Minister, I've been trying to get hold of you. Please check your DM. I'm thinking of my deputy minister. He says, check your DM. I'm like, okay, DM. Maybe I must call my DM. And then I asked at home, I asked my grandson, what is this? My grandson said, if you are on Instagram, you must understand everything around it. Let me show you. You can like, you can follow, you can go to message, then go into the message, you'll find the message. What did I do? I found Graceland. He had been sending lots of messages. This one, don't know what is DM. I was thinking that is my deputy minister. But all I'm saying to you guys in closing, you know what? Take everything. Learn all the time. Push yourself all the time. Do as much as you can, because if you're going to live with negative in your system, you'll never be able to get anywhere. Remove negative from your system, but demand of government to deliver on things that government has promised. That one, angeke ngithi just because, if I made a promise that we are here today, that next year, we're going to be, not next year, we're going to start doing the door-to-door. I have to speak to the MECs and say to the MECs, let's do the door-to-door. You'll see me. The door-to-door will be started by me. Because I also said, COVID-19 has given me that thought. So it means we must protect ourselves as we go out and do the door-to-door, but we cannot be here all the time. Even now, I was worried, what is the time? How many hours are we supposed to hear? So now I must also shut up and go, because I can talk non-stop. Thank you very much. It's the partners in sexual health. But partners in sexual health, they get it and then you're going to give everyone. Yes. I was about to say, no, partners in health, I can't give them this. I've got to give the young people. Then the other one is KDF. It's also a pack. Thank you. And then the other one is, Lulwazi. There you are. Thank you. Thank you very much, guys. But, a picture there. We're supposed to take a picture. Yeah, please go ahead. Yes, go ahead.
Honorable Minister, representative country of the United Nations, young people, it's really good to spend time with you on this World Population Day. I am the founder and CEO of a company called GovChat. Many of you maybe remember GovChat previously as a company called Mixit. And so I was part of the team that founded Mixit, and when Mixit closed down, I came to Minister Zulu and many cabinet ministers to say, I would like to provide a platform to allow citizens to engage with government a lot easier, which is what I did. Today, we have 5.5 million users on that platform at no cost to the South African government. To date, we have spent about 50 million rand to allow South African citizens to engage with government because technology is expensive. But what I want to tell you today is do not give up. Do not give up on the South African government. We have amazing leaders in this country. We have one of the youngest DGs in the country in this department of DSD. And so we must honor our leaders. I am here to tell you that I hear your stories. Minister, thank you for sharing your story. My story is one as well where when Mixit closed down, I did not know what I was going to do. I did not come to the South African government to ask for money, but I came to say I'm here to offer my skill and did not know how I was going to build GovChat. And I lost everything.
And you know, guys, when he says he lost everything, it might sound like it's an understatement. He was almost not with a house nor anything. Zero. And he used to run around chasing us when we said we were coming to Parliament. People almost literally wanted to run away from him because they know he's going to tell them his problem. When he says he lost everything, it is no joke. It was a very, very serious thing. But what happened, he was persistent. He stood there by those steps at
Parliament,
in Parliament, waiting for anybody who comes along and grab you and say, this is my plight, but I'm not begging. I want to do something. So when you see him today here, some might think, oh, now we are busy promoting GovChat. It's because I've walked a long mile with this young man, not knowing him from nowhere. But because he was a fighter, one day he ended up, when he was pulling himself up, he came, and I thought to myself, oh, here he goes again. He's got another plan. And he kept on having those plans, and they kept on changing. But one thing that happened, he had people that committed to assisting him. I committed to assisting him. And then, like I said, I didn't know him from nowhere. I wasn't looking for anything. Mine was, how do you help a young person who's fallen down flat, but is still able to stand up and say, I want to get somewhere. He's got his own story to tell. Some other day, he ended up in New York, he ended up in Washington. I ended up calling the ambassador and said, this young man is coming to Washington. Can you just please give him an audience? He was bold enough to even ask and ended up in that embassy, meeting with that ambassador. So for me, he is an example of not sitting in a corner and complaining, but saying, I've fallen down, I want to get up, I'm going to get up, I'm going to do something about it. Thank you.
Thank you. So what Minister is trying to say is do not give up. When I was on my last and I was posting a lot of the concepts, the plans that Minister's talking about on social media, and the day that I actually decided to give up, someone called me that I don't know from above, but was watching the work that I was doing on social media and asked me if I needed help, and I said, no, thank you, I'm done. And his response was, here is 10 million rand. Take that concept and turn it into something tangible. 11 months later, Another company comes with 20 million rand. A month later, another 10, 40 million rand in 12 months because I did not give up. Do not give up on your dreams. So today, I want to come personally, not as the founder of GovChat. Personally, Eldred Jordan, who is a proud father of 3 girls, would want to come and donate 10,000 rand to this organization here today. Thank you so much.
Manbona mina nibona imali. Aye. What he didn't tell you is that yesterday he received a global award from one of the biggest organizations, digital technology companies, Amazon Web-Based Services. He was recognized for the work that he's done with us through SASA by bringing on, I think, the online, all the applications we did for the 350 grant, we did online. And he was recognized for that yesterday. He didn't tell you that. So I think we must acknowledge that as well.
Yeah, it comes to that time to say goodbye. But before we say goodbye, I just want to give everyone who came to this podium and give their input, the Honorable Minister, the speakers. Let's just give everyone who made this day possible a Coca-Cola clap. Minister, you're learning something. Welcome to Cape Town. So a Coca-Cola clap goes 1, 2, 3, 1, 2, 3, brrr. Are we ready? Yes. Let's go. Brrr. We are almost at the end of our program. The funny thing about this part is that we always forget to say thanks to the person giving thanks. So thank you in advance to the person who's going to giving the vote of thanks and closure. On my behalf, I would like to say thank you for allowing me this opportunity. It is also a learning platform for us young people to come stand and be program directors. I think one day I should be the Speaker of the Parliament, I wish. Yeah, so it's possible. Thank you for the opportunity, and thank you, Honorable Minister. And now I would like to call upon Ms. Z. Kumalo Nyembe to give us the vote of thanks. Give her a round of applause, and thank you, everyone.
Mek Manaka speaks. How do I stand here and recite love poems while hatred is expanding its invasion in our homes? A mother at 16 suffocating the next generation. A father decreasing his financial savings to feed his drinking habits while food at home is served on empty plates and poverty opening criminal's gates. Another car has been jacked in my area. Another sister has been raped in my area. Another house has been burgled into in my area, but then there's just silence. And like, how do I stand here all day and tell you that everything is all right, but when I really look, fire burns in my interior. Tears remain in the eyes, frozen, ready to make it, but remain unchosen, so emotions start flooding down with cruel intentions, these false actions acted by these actors, misleading husbands who start admiring thighs of girls young enough to be their daughters. What happened, Mzansi? South Africa, what happened? What happened to the life that was alive with possibilities? A speak of our nation so wonderful as though we're singing. A walk on our land so gentle as though we're dancing. Just stop and listen. Listen to the sound of our people crying out loud for mental liberation. Read the signs and listen. Listen to the signs. Listen to the cries of the young people. Listen to the voice of the lesbians, gays, bisexual, intersex, transgender, plus, by the way, stands for we are evolving and we are okay with that. Listen to the discomforts of the disabled. Read the stigma that you paint every day through your looks. And tell me you don't hear the silence. Sanbonan Dumelang. DG, this is how you do it. Don't talk about this thing to young people, you do it. As we close, I'm from the Youth Development Directorate of this department, and we are working very well with population units. Thank you guys for being here. This is only for young people, DG, young people, not calendar fitting people, young people. There's an age group, the doctor put it very well, young people. The question is twofold. I'm going to ask a question. Is there still a roving mic? Just one person will get this $100. Here is the 100 rand. I'm not like DG. It's here. Is there something that you have learned today that you did not know? Just one thing. Whether it's a term that you didn't know, whether it's, there's a lady here, wait me a second. The lady with the nice hat. Summer is already here. Come stand up. What's your name? Where are you from? What have you learned?
Hello everybody, my name is Portia. I'm from Siakwazi and I'm staying in Delft. Something I learned today is to never give up. And it's something that I only didn't learn today. I've learned it in 2018 when my mommy passed on. Any case, what I want to tell you, like young ladies sitting over there, never give up on your dreams. Keep on going. If you fall down, lift up yourself and continue walking. Thank you.
Okay. That was the short listing of the 100 rand. For you to get the 100 rand, Tracy Lee, where's Tracy Lee? She must listen to this question now. Tracy Lee, listen, luister. No. Antwoord nie. Luister asseblief. For you to get now the 100 rands, because this is what you have learned, we want to find out. Tracy Lee, are you listening? What do you think is stopping other young people from knowing this information? Why are other young people giving up, whereas there is such information and motivation around us of not giving up? Can we please give her a big round of applause? Here's your $100. Yo! And social media is capturing DG handing over. I have just lost. The acting DG is captured on social media doing the actual handover. Ladies and gentlemen, we really wrote so many notes, but because of time, would really just want to make it very short for your time, for your ears, for the partners. It would be very important for us to really give a big round of applause and acknowledge the population units that are the brains, the hearts, the people, the engine behind what has happened today. Can we please give them a big round of applause? Government cannot work alone, and Minister has made it very clear that it is through different structures, organizations, that government can actually achieve its objectives. So we want to thank the UNFPA. Can we please give a big round of applause to SAR? Can we please give a big round of applause to PHS? Lulwazi Lwethu, where's that beautiful lady? Oh, Pio. Jay, did you guys see it? Yo, can we please give a big round of applause to our host, Kylie Chat Development Forum? Can we please give a big round of a big ups?
We saw a lot of people taking pictures and videos. You still have your pens? Please write this down. Those pictures that you've taken of today, we need to make such sessions trend. We heard someone saying that government must come down and sit. Government is here, and we are seated. We are seated, and this is exactly how we are going to make sure that things, you guys must understand the powerhouse that you are. There's a young man who was saying Jabu is not so hot. If you do a video and you put Jabu, but if you put Tulufelo, yeah, Tulufelo is same time, so people will look. Tulufelo was speaking so easy about, the other day, I was in a dialogue and conversation with World Health Organization. I'm like, this guy is engaging with World Health Organization. We have leadership right here in the house. So for all the young people who are in here, who are leaders, we want to give a big round of applause for the future that you have in front of you. Let's please make it trend. On your pictures, hashtag because we can. On your pictures, hashtag Department of Social Development. We are on Facebook, we are on Instagram, we are on Twitter, and if you're sitting next to a minister, please don't type your password next to her. She's exposed herself because she said, when they put passwords, I look. Just be careful. Otherwise, Brother Elred Jordan, your position and the millions in your account are not safe because you might be busy with staff payment and minister is looking. Just be careful. But we want to also give you a big round of applause. There's a young man there at the back who was saying when you came up and you're like, yeah, you remember Mix It? It's like, yay, this is the guy behind my first girlfriend. You are really a living inspiration. And these are the stories that we need to speak of more. And in this room, it becomes our responsibility to come close to people like Brother Elric, not because we know how much money is in his account and how hot he is. It's not even in his account, it's the company account, Siba. It's the company account. We must get close to people like him, not only because he's hot and, he's looking all, but because we must find a way of drawing inspiration from practical examples that we can see. And the lady at the back who got the $100, here is your proof that you can actually get up and do it by yourselves. Lastly, communications unit deserves acknowledgement and applause. These guys have changed gears. Nomfundo and your team, these guys with COVID have had to change gears and really find a way of communicating the work that the department is doing in a different way. We want to give a big round of applause to the communication units and the work that they're doing. Without going through everyone who's in the room, thank you so much. With the powers vested in me, I hereby declare this session closed. So we'll all get up and then leadership will evacuate and then we'll make announcement about where do we deal with stomach politics. You see, Carlos Somtom Chasiho, yeah. When you kalelani, ukinu tulelani, when you ka. Aibo, you see, Carlos Somtom Chasiho, yeah. When you ka. Young people, you can't some danasi, oh yeah.